Good afternoon, everyone. Apologies for the technical challenges. We were just working in the background to get that resolved with our tech team. So thanks to the team for managing to get us live. We appreciate everybody who's hung on and stayed with us. We really wanted to have a robust conversation. So I think we're going to jump straight in. I'm joined by a really esteemed panel today to talk about the Maternal Support Grant. So I want us to have as much opportunity to engage in your questions, but also to give the panelists an opportunity to speak to the issue. But for everybody who's joining us for the first time or who hasn't been a part of the Perspective series, just to give you a little bit of context, this is an event that we host quarterly here at DGMT, really trying to create a platform between different stakeholders in civil society, private sector, policymaker, etc., to come together to talk about the most pressing issues in South Africa. And we really feel convening is a critical part of being able to create a space to have those kinds of conversations. So today we wanted to talk about the case for the Maternal Support Grant. So I'm joined by an amazing panel who've worked in this area of work for either through publishing and research or doing advocacy work for a number of years. So I'm really privileged to be joined by Paula Proudlock, who is a senior researcher at UCT based at the Children's Institute. I'm also joined by Dr. Wanga Zembe, who's a senior specialist scientist at the South African Medical Research Council. And then I'm also joined by Dr. Janine Hicks, who's a senior lecturer at the School of Law at UKZN and was also a project lead on the SA Law Reform Report on benefits for self-employed workers in the informal economy. And we're going to get an opportunity to chat a little bit more about that. But just to frame the conversation for today and why we feel like it's important to be having this conversation, particularly right now in South Africa, is just recognizing that a majority of women, particularly pregnant women, are excluded from the social protection system in South Africa. We know that in South Africa right now, approximately 13 million children access the child support grant, but due to a number of reasons, a lot of children aren't able to access that at birth. So the call that we've been making alongside our colleagues on the call and the MSG Coalition, which we'll talk about a little bit later, is about extending that, the child support grant into pregnancy, effectively converting it into a maternal support grant. And we'll talk about the specifics of what that looks like, why we think that's an important case to be making. But one of the reasons is so that we can intervene at the most critical point of a mother's journey when she is either due to the fact that she needs to off of work, not earning an income, but also seeing her own personal costs increase, whether due to having to go to the hospital or the clinic more regularly, transport costs associated with that. How do we environment that is really conducive? But we also know that there are also real health outcomes that are attached to having a healthy pregnancy, and that is associated with being able to have the economic means to do that. So we're going to chat a little bit about what does that mean, what does that look like, and what are some of those economic challenges that mothers face when they're pregnant. So where I really want to start the conversation today is bringing you in, Wanga, because you've done a lot of work around the experiences, the lived experiences of mothers in South Africa. I remember even during the pandemic, you did some really important work around the kinds of trade-offs that mothers were having to make around the income that they did have and supporting their children. Can you talk a little bit about the impact of inequality on pregnant women, particularly in that critical phase before birth? Oh, Wanga, you're on mute, if you can unmute.
Oh, sorry. Can you hear me now?
We can hear you. I'm going to check with the rest of my panelists if you sound a little bit clear. You sound a little bit far away just for a second there. Go ahead again, Wanga. Let's see if that's a little bit better.
Can you hear me now?
Yes, much better. Okay, go ahead.
Okay. Great. So, Kentse, pregnancy is generally a vulnerable time for all women, right? But it's particularly a difficult and vulnerable time for low-income women. And that's because poverty and inequality directly affects how pregnant women who are in low-income settings and in low-income situations, how they're able to access care. You mentioned that briefly in terms of they'll be able to attend ANC visits, if that includes healthcare costs, being able to, and then much more fundamentally, the nutritional intake and the diet that a pregnant woman needs, because pregnancy has additional nutritional requirements to what that woman would have been eating in general before the pregnancy. And so the absence of a good, appropriate, adequate diet in pregnancy and the stress around that, which for the pregnant women I work with in my studies, it's not just that she worries about her own health and her own need for food in this vulnerable time of pregnancy, but often it's worrying about the food needs and the other basic needs of the other members of the household, especially the children. And so the impact of that means that then the pregnant woman is not able to get the adequate diet and the right mix of proteins, carbohydrates, fats, oils, macro and micronutrients that are needed in pregnancy. And what that does is that it affects the fetal development, like the organ development of the fetus, of the baby that's growing inside of her, brain function, brain health. It affects the odds or the risks of that child experiencing developmental delays once they are born. And then more fundamentally, because all of these needs, the state of deprivation and poverty takes such a high toll on mothers, including pregnant mothers, it means that the mental health status of that mother in pregnancy directly affects, again, the development of the baby inside of that fetus. We now know that maternal mental stress will change the brain of the child inside of her. And the function of it. It will affect the emotional and cognitive development of that child once they are born, they're outside in the world. And that has all sorts of ramifications that are so far-reaching, right into adulthood. And so really the poverty and inequality, it's not just inequality, it's the poverty that's tied to that inequality. It's the extreme deprivation tied to that inequality. The combination of those on maternal health and the resultant impact on child health and nutritional outcomes is very profound.
Thanks, Wanga. And I think what you're saying is important in acknowledging just the socioeconomic context that we find ourselves in South Africa. And a lot of the research that has been done up until this point has really been leveraging what we've been seeing in terms of the impact of the child support grant, which we know has been one of our most targeted and impactful ways of assisting children who are on the margins or who are living in poverty or who are needing that additional support in their household context and environment. And Paula, this is where I want to bring you a little bit in, because this is where the Children's Institute has done a lot of work on the benefits of the child support grant over the last couple of decades and the kind of impact that we've seen. In a lot of the conversations that we have, we talk about, can we imagine what would happen if those benefits that we are seeing children who are accessing the child support grant get could be extended into pregnancy? Can you speak a little bit to what have we been seeing in terms of the trends of the child support grant and why it's important to still ensure that many children have access to it, and then linking that back to this conversation on the MSG?
Thanks, Kentse. You know, there have been many impact studies on the health benefits of the child support grant and all the other grants as well. And what that evidence shows is that those grants are primarily used for meeting basic needs. So, some of the opposition to grants is often around the fact that is concerned that grants will be spent on non-essential items. But what we're finding from all the research that's been done on grants, both in South Africa and internationally, is that they're mainly spent on basic needs, particularly food. So if one looks at all the studies going all the way back to 2012, for instance, a study by DSD and SASA and UNICEF, they found that the top reported uses of the child support grant was food, education, clothing and household goods, health, and transport. And that represented 94% 5% of the reported uses of that grant. And all the impact assessments since then on the child support grant have confirmed that expenditure is mainly on basic needs. Also, more recent studies on the social relief of distress grant have also showed, this is the 350 grant, that most of the recipients are spending that grant on food. So if one is thinking mainly about, problems around nutritional status of mothers and of children, you can see that most people are expending these social grants on food. And, so that is going to, if we were to increase the investment in social grants and ensure that pregnant moms and moms caring for babies have increased access to income to buy food, we will see an increased purchase of nutritional food. We also see from these studies that the CSG has many positive impacts for children. So we see reduced poverty and child hunger. We see improved school attendance and improved school retention, and also reduced risk-taking behavior by adolescents. And then for adults, all the evidence also shows for adults who receive grants, positive outcomes such as reduced poverty in the household, increased work-seeking behavior by the adults who receive it. Specifically, if women receive grants, you see a lot of small business startups where the women are using the cash received from the grants to buy the stock they need to start a small business. You also see adults investing in further education. And because a lot of the grants in South Africa actually reach women, we have seen increased gender equality as a result of the grants. If we were to remove these grants, we would really be going back to square one when it comes to gender equality in South Africa. And any further investments into grants that reach women will improve gender equality in South Africa. So reaching pregnant women and moms looking after newborns will improve our gender equality picture in South Africa.
Thanks, Paula. I think a lot of what you're saying links quite closely with where Wanga kicked us off. And Wanga, I want to bring you back into the conversation because I think a lot of the evidence that Paula is sharing with us around what we've been seeing in terms of how the CSG has been utilized and the impact that it has speaks a lot to some of the conversations and even the misconceptions that we see being published about what would it look like to extend the CSG into pregnancy. Could you speak to, because you often frame it as, the maternal support grant is not charity. You often speak about that in your work. Could you maybe share a little bit around why, based on this evidence that Paul has been sharing, why the MSG should be seen as a right and not a handout?
Thank you, Kentse. I think first, if I may just add to what Paula said.
Oh, Wanga, would you mind coming a little bit closer to the mic? I think we're just having a similar issue.
Can you hear me now? You can hear me?
Okay. Say that again, Wanga.
Hi, can you hear me?
Yes, we can. There's a little bit of feedback. So maybe if you can quickly answer, and then we'll try to reconnect with the mic again.
Okay. Hi, can you hear me now? It's a lot better now. Now I can't hear you, Kent.
Oh, okay. Okay. So then let's do this one. We're going to come back to this question. If you can disconnect, and then I'll come back to you so that we can figure out with the mic. And I'll ask Janine just to come in a little bit, because I do think this conversation around like misconceptions is important. But Janine, maybe pivoting a little bit, because I think you've attacked this work from a different angle. And as Paula was saying, this is not the first time that we're having this conversation, even though the coalition of civil society organizations that has come together to push for this has been formed recently in 2024. This work is actually going back to 2012. And specifically, there was a piece of research that you were involved in, Project 143, that was looking at how would we structure this, particularly when we're talking about maternity benefits for self-employed and women who are working in the informal sector, and thinking about what Paula was just sharing around the inequality that women face in South Africa, why this is important. Could you share a little bit about the work that you did and how it adds to the conversation that we're having today?
Absolutely. And would you please, Kentse, just let me know if I start freezing, and then I'm afraid I'll have to turn my camera off. Okay. So yes, this formed part of, and it actually, the South African Law Reform Commission has added its voice to this call for a maternal support grant. We were tasked in terms of Project 143, we were examining more broadly our social security system in relation to social insurance and social assistance in maternity protections. And we were specifically focusing on self-employed women, in essence, women in the informal economy, but self-employed women as well, who are currently excluded by our labor law framework from our social insurance, such as unemployment insurance, maternity benefits. So self-employed workers, women in the informal economy may not contribute to the unemployment insurance fund because they're not recognized as employees, even if they wanted to. And so they cannot take paid maternity leave. And equally, their partners are prevented from taking parental leave. So none of the maternity protections and provisions that are attached to our unemployment insurance fund are available to stakeholders in the informal economy and self-employed workers. So we began by interrogating that as the Law Reform Commission. We worked with the amazing people in the spaces of WIGO, SASEWA, the South African Self-Employed Workers Association, WASA, and I believe you've made our final report is out. It was delivered to the 6th administration. We submitted it to our then Minister of Economy and Labour. So this was back in 2023, the final report came out. And we've got a slate of recommendations around our primary work, which was extending the UIF system to all categories of workers, to self-employed workers, so that they can draw down those benefits. But what came out of the study and how this ties back to this work is when we look at, for instance, our International Labour Organization's Convention on Maternity Protection, it speaks about the need, if we are to have the greatest scope for universal coverage of support, that you have to have a combination of social insurance, like a maternity benefits UIF system, coupled with social assistance. So the social insurance is the social security, you contribute to a fund and you can draw down paid leave, but it has to be coupled with social assistance, which takes the form, for instance, then of our social grants administered by our Department of Social Development, particularly in contexts of of poverty, of inequality, and the informal nature of work. So one of our specific recommendations was that drawing on the work and the research that Paula has referenced is to backdate, to take the existing model of the child support grant, don't reinvent and create a separate new grant, but backdate. Extend backwards the child support grant into a pregnancy grant or a maternal support grant to all eligible, poor and vulnerable women, not just self-employed women. So that became one of the specific recommendations. And it became clear from our research around the maternity protections, drawing this back to the points that Paula was making and that you were asking Wanga to come in on. Why is this significant and why is this not a handout? Why is this a rights-based issue? It comes back to that old feminist issue around the burden of unpaid care work and the impact that that has on women's economic participation. And what our studies indicate is that unpaid care work, women taking leave, sacrificing the kinds of choices, career choices you make, the kinds of the informal and insecure and low status and part-time nature of the work that many women are obliged to undertake to juggle and manage their domestic responsibilities, how that impacts on their career, on their economic participation, on sexual and reproductive health rights and outcomes. And these kinds of factors and issues in a context like South Africa aggravate our existing socioeconomic challenges of poverty and inequality and impacting on women. So the right, it is, in fact, it's a right. The maternity support is a right of women because of that unpaid care work that she provides. It's based on the recognition of her labor that she does in the home and her reproductive contribution towards society. We also, we have such a strong legal basis for this because of the historic discrimination that women bear and their continued vulnerability. We have, and we made a clear case to the Law Reform Commission, which in turn then carried that forward to the stakeholders in government, that the state actually is obliged to undertake measures like this to deliver on its obligations to promote gender equality and ensure access to health, social security, children's rights, etc.
Thanks, Janine. I think that's such helpful feedback. And I'll just ask the tech team to just drop in that Project 143 report into the chat box for our colleagues who are wanting to also read further. Wanga, I'm hoping technology is on our side now.
Yes.
Let's see you a little bit better.
Can you hear me now?
Yes. Okay, that is a little bit better. Okay, so maybe
a little bit better.
It is a little bit better. So maybe just then weaving through, because I think where we dropped off was around how this particular intervention is a right and not a handout. And I think Janine sort of covered some pieces that we've been reflecting on. And then I wanted to bring you into the about those myths and misconceptions. But if you can maybe then broaden that a little bit to some of the work that you've been doing, particularly around your research on maternal mental health and the impact on child outcomes and some of the research linked to stunting, on why particularly a maternal health grant actually pays for itself. The country, if we're serious around turning around some of the cycles of poverty that we're seeing being perpetuated in our society, why investing in an intervention like this is fundamentally critical.
Thank you, Kentse. You can hear me now. Okay, okay, great. You know, so absolutely, it's. I think I wanted to first just touch on a little bit on the question you initially asked me, and Janine answered so comprehensively. But I wanted to say that yes, we correctly center child health and outcomes, you know, in the argument for the Maternal Support Grant. But the other rights-based argument to it is that women are human beings, so they have a right to human rights. It's a human right because they are humans. They're not just incubators. And it gets very tricky when we are only treating them as incubators. The reason why until now we've not had any allowance or accounting for women before children are born, it's because we are child-centered in our thinking of what's important, and that's you know, that has its place. But women, just by the mere fact that they are alive and in the world as full human beings, they deserve protection, they deserve support. And then of course what Janine speaks on, the fact that they take on the weight of bringing into the world humanity and then raising, means that they deserve and have a right to additional protection, to even extra care and consideration, because of the incredible role they play in humanity and in the development of countries and the world. So I think I just wanted to bring in my usual spiel on that, and then and then to answer more fundamentally, I mean, when we do consider how maternal health, how a mother and a pregnant mother, because a person becomes a mother from pregnancy, already they're a mother, right? So how a mother feels about herself, what she has preoccupying her mind during pregnancy, what she has, what needs she has that are not being met, all of it has such a profound impact on her mental health. And as I say, during pregnancy, not later on, in pregnancy itself, that level of chronic stress, the constant, what my participants in the studies that I conduct, you know, they explain the minute by minute daily toll of trying to figure out how to make a plan, how to provide, and often not for themselves, how to provide for the household. And that the mental toll of that, of trying to think, do you buy electricity, which is an essential need, and you will need it to cook the food, or do you buy the food? Do you split the 50 Rand and pay 20 Rand for electricity then how are you going to buy food with the 30 rand that's going to feed the children? The data we have, including from Needs Creme during COVID, shows that part of what has made child hunger, which is a critical issue now in South Africa again, but part of what contains it, part of what keeps it from being as extreme as it should be, given the economic space we're in, is that mothers do what is called shielding. They shield their children from hunger. They forego their own legitimate needs for nutrition and care for their children. And so if the mother is pregnant, she doesn't stop doing that. She continues to prioritize the needs of others in the household, particularly the children. She will continue to forego her own meal and her own need for that meal so that the children are well fed. And so if that same woman is growing another human being inside her who is affected by every feeling that she experiences, long before they are affected by the fact that there's no food coming in, they are just affected by her mental state. It affects how their brains are shaped in pregnancy, in utero. It affects what brain function, the cognitive development. It affects, now we know, for instance, that the combination of iron and omega-3 fatty acids in pregnancy are protective against child developmental delays. So that's huge, right? Because actually having a child with developmental delays as a low-income mother compounds your problems in ways you can't even imagine. And so it's so critical. And then, of course, once that child is born, their own birth outcomes, whether they are born alive at all, is determined by that relationship between both their maternal mental health and her nutritional status in pregnancy. And how they are, so whether that child gets born at all, so infant deaths are linked to poor maternal nutritional status, whether they are born with other poor birth outcomes like low birth weight, neonatal issues, neurodevelopmental issues, all of that happens in that critical stage just right after they're born and then follows them throughout their lives. And so this is the critical point about introducing the MSG in pregnancy is that, as Paula says, the research shows that the CSG, as small as it is, it's doing things that are great. But evidence is also clear. As a small cash transfer, for it to have a chance in impacting, especially on the big outcomes we're talking about, like stunting, it has to be received within the first 3 months of birth. So those early, right after birth, you have to introduce it as early as possible. Our evidence shows that most children only start receiving it after 6 months after birth. So in terms of the pathway to malnutrition, that's too late. So the MSG coming in, the CSG effectively coming in pregnancy would enable this seamless transition into the CSG, enabling that child to have that form of support as early as possible. And then we increase the odds of that small cash transfer being protective against stunting. Can you see the argument is so clear and compelling? Thanks.
Thanks, Wanga. I think what you're fundamentally speaking to is investing in our human capital. And I think there's already so much compelling evidence and research about how investing, particularly in these critical early years, as you say, has such a profound longer-term economic impact. Even when we're talking about being able to read, how children are set up to thrive in early learning programs, thinking about the high dropout rates, thinking about once learners get to matric, and so on and so on. So you can almost see the longer term compound piece. And I just wanted to highlight that, because oftentimes when we're having this conversation, it's a trade-off of, okay, well, actually, let me rather invest in, for example, youth unemployment programs versus investing in this particular area. And I think what I'm taking from what you're saying is that it's not an either or, it's about understanding how the compound investment of stopping some of the challenges that you're speaking to at this critical window actually basically allows us to perhaps even prevent some of the longer term challenges that we see in our society. And I think that's really fundamental. So thanks for that one. I think that was a really great conceptualization of understanding why we're making this case. Paula, I want to bring you into the conversation here, because I think what we're also talking about, and I think this is a little bit about what Janine was also framing, is why social protection in general is important, particularly society like South Africa, where we're still grappling with such high levels of inequality and so many people being left out of economic opportunities. And I want to link it to a question that's also come from one of the viewers online around, if we're talking about social protection and safety nets and why that's useful for families and individuals. But we also know at the same time that we have been having this conversation about the universal basic income. So maybe if you can answer the question of, why are social safety nets, number one, important and critical in our context? But how do we approach the conversation of an MSG in a context where we are also having a conversation about the universal basic income grant?
Okay, so at the moment we don't yet have a universal basic income grant, but we do have the COVID SRD, which is the 350 grant. And if one looks at that grant to see who's actually applying for it and receiving it, there's approximately 9 million unemployed adults accessing it per month, and more than half of these unemployed adults are women, and at least a third, if not more, are primary caregivers of children. And most of the recipients of this grant are also young people. So there's a large group of women of childbearing age that are in that group that are accessing it. But of course, this 350 grant is very small, and 350 Rand is not even enough for one person to have half of the nutrition they need. Never mind if they are pregnant and are carrying a baby and need to have additional nutrition as a mother. So, the talk around the universal basic income grant is to have a grant that is at least at the food poverty line, if not higher. But the thing with that grant is it's aimed at the needs of that individual. So it's an individually targeted grant. It's not targeted at a household or at a pregnant woman who's carrying a baby. So one would need a top up to that to actually provide for the increased needs that occur during pregnancy and during caring for a newborn. So one can't really say that a universal basic income grant would in a way knock out the need for a maternity support grant. And I think if we juxtapose that with employed people, saying that universal basic income would remove the need for maternity support is like saying that if a person has a job and receives income from the job, they don't need maternity support. So, we would be wanting to see a combination of both. Similarly, we don't want to see the child support grant done away with in the context of universal basic income. And we'd want to see that when we do get a UBIG, we get a UBIG that is for adults, and also children also get a UBIG. So the child support grant would need to be converted into the UBIG for children and be the same amount that is going to the adults. And that's particularly important from a gender equity perspective, that you don't want women who are primarily the caregivers of children receiving less income through that universal basic income system. Has that answered, Kentse?
Yes. Thanks, Paula. I think that's useful. Is there anything else that you'd wanted to add?
On that particular question, I think just to add that, recently the maternal support grant proposal did go to cabinet for consideration, and it unfortunately wasn't approved at that meeting. And at a similar time, the UBIG proposal went to cabinet and was approved for going forward. So, sometimes these proposals unfortunately do get juxtaposed against each other, but that's because of financial arguments, that there's not enough for all of this, so we need to go incrementally and get one before the other. So unfortunately, the timing, wasn't very good. But what we now need to look at is, as we move into the discussions around the universal basic income, how do we ensure that it includes the idea of the maternal support grant? How do we adapt that proposal to ensure that pregnant women are included and receive additional income for the pregnancy period?
Thanks, Paula. I think that's an important point to bring into the conversation, because as we mentioned, that this has been an evolving piece of work, and now we've reached the point where we are recognizing that we do need greater public demand and greater engagement with policymakers around the cases that you and the rest of the panel have been making for why this is important. Janine, I want to bring you in here because I think it links quite closely to what Paul has been sharing and the feedback, obviously, that we would have gotten, particularly from, and I think it was presented not necessarily to Cabinet, but it was the Social Protection Community and Human Development Subcommittee that this was presented to. And I wanted you to speak a little bit to, okay, so where to next? Because I think this raises a couple of questions for us who are working in the space, whether you are working, in civil society or in the policymaking space, particularly around the legal argument for this, but we also have a constitutional framework to reference. And I'm specifically thinking here around the Constitution makes reference to everyone having the right to access social security and how the state is required to take reasonable and legislative measures within its available resources, which I think is a little bit of what Paula was speaking to. But a lot of the work that you've done around this was thinking about how do we then make this possible? Could you speak a little bit to the legal arguments around this, but specifically around how Section 27 of the Constitution, which guarantees the right to healthcare and social security, applies in this conversation that we're having?
Okay, sure. If I can just pick up where Paula left off, about Cabinet juggling, and it would appear rejecting this proposal in favor of others. As far as the fact that the Law Reform Commission has adopted the Project 143 report, and these were submitted then to our Ministers for Social Development and Economic and Labour, which included these recommendations of expanding our unemployment insurance fund coverage, but also extending and backdating the child support grant in the form of a pregnancy or maternal support grant. So those recommendations obviously do not have force of law. It's up to the department's prerogative to consider the Commission's recommendations. They were tabled with the sixth administration. From the Law Reform Commission side, we have done due diligence in terms of following up then with the incoming seventh administration and engaging with the Chief of Staff and the Ministry to alert them to the reports that were tabled with their predecessors. I think it would be important to determine, we're hazarding guesses as to why the MSG did not find favor. I think it would be important to ascertain what the actual reasons were behind that. And clearly, the further engagements are required. I think we can draw comfort from the fact that we have the DSD on our side, that they believe that this is an important intervention and wish to take it up. As far as leveraging the rights-based argument and the legal argument, which I'll speak to now, I think it's important to note that the Commission for Gender Equality, this issue arose when I was a commissioner with the Commission for Gender Equality, and we, in fact, leveraged this up and I believe contributed towards this coming before the Law Reform Commission. So the Gender Commission does have a constitutional responsibility to monitor, to lobby, to advise, etc., on issues pertaining to gender equality. So part of our intervention should be working with the Gender Commission and urging
Janine, I think we've lost you. I'm just looking at my panelists. I think if you come back, or if you can still hear us, it might be worth turning off your video. Let's see if we can do that. Janine? Let's just give it a second and see.
Then lobby and use their...
Janine? Okay. So Janine has dropped off. So clearly technology is not on our side
Yeah.
today.
I'm turning my camera off. I think that's affecting the bandwidth. Can you hear me now?
There we go. So we lost you,
Yeah,
Janine,
all right.
speaking about the Gender Commission. So if you can maybe pick up from there.
Okay, all right. I was saying that the Gender Commission had initiated and engaged with the departments on the issue of maternity provisions and that we should revert to the Commission for Gender Equality as a partner in this campaign. They have the constitutional mandate to monitor the advise on all matters relating to gender equality. And I think we would do well to engage with the CGE and ask them to use that space and their powers to engage now with those ministries, directing them, for instance, as well to the Law Reform Commission's findings and recommendations. I think there's a wonderful resource there for the ministry to draw on in making its case to Cabinet as to why the South African government is obliged to implement these measures. And I'm afraid it's not enough to say that there aren't available resources, because as we'll see, the standard is very high in this regard. So we have, before we move to Section 27, we have as a country ratified, there's a huge slate of international protocols and conventions and regional conventions that we've ratified, which oblige the government in terms of international law to enact measures to give effect to those obligations. I won't go into those in detail. For those of you who are interested, they're documented in the Law Reform Commission's final report. But they range from, you know, the good old elimination of all forms of discrimination against women, and the Convention on the Rights of the Child, and our Economic, Social and Cultural Rights Convention. There's huge weight from our African Charter and the protocols, the African Charter, which recognize women's ingrained and institutionalized poverty, the burden of responsibility of the family, and the impact that this has on women's poverty in particular. This is an issue impacting on women in the global South. But there's strong measures in terms of our International Labour Organization. So there's the Maternity Protection Convention, which South Africa hasn't ratified, but which remains persuasive. But we have our social protection floors. And just to give you an example of this, these are guarantees and duties imposed on the state to put in place comprehensive social protection systems and extending existing social security coverage. And it obliges countries like South Africa to establish these minimum standards or basic levels of social protection, and prioritizing those most in need, such as people living in situations of poverty, those who are, you know, falling through the cracks, who are not protected by existing social protection mechanisms, and, you know, particularly recognizing vulnerable categories of people. And I just want to draw attention. So that's that ILO recommendation 202 on the social floors. It talks about basic income security at a nationally defined minimum level for persons unable to earn sufficient income in cases of maternity. So there it is, loud and clear, very specific obligations on the state. So we've drilled some of this down. If you asked me to direct us towards Section 27, and our two key entry points are these. It is Section 27, which is that basket of social security and socioeconomic provisions. So Section 27 specifically states that everyone has the right to have equal access to healthcare services, specifically mentioning reproductive healthcare, and specifically referencing social security, noting that if people are unable to support themselves and to support their dependents, this includes social assistance, which brings us back to the social grants. And the state is obliged, in terms of that same right in the Bill of Rights, Section 27, to adopt reasonable legislative and other measures to achieve the progressive realization of these rights. What does that mean? It means slowly but surely enacting the measures to ensure that eventually people are able to realize those rights. But that's not just a never, never will we live to see that day. These kinds of issues have come before our courts, which has required government departments to prioritize those who are most vulnerable, prioritize those who've suffered discrimination and the embedded impacts of discrimination and inequality in South Africa. We have to, our next strongest point is our equality clause, our Section 9 provision, which talks about equal protection and equal benefit of the law. But we have a very strong, again, leverage point in that the state has to adopt measures to protect or advance people disadvantaged by unfair discrimination. And if you think back to the points Wanga was making about our embedded inequality, about the particular gendered burden of care, those are embedded forms of disadvantage and unfair discrimination. And the Bill of Rights is alive to that and recognizes that people may not be discriminated against on the basis of gender, sex, or pregnancy. So in our unstable connection, we haven't even, made reference to us. And the Child Support Grant and our Maternity Support Grant specifically speak to the state's obligation to ensure that the best interests of the child are protected. So as my final kind of pitch and where our entry point is and our leverage with the state, when the state pushes back and says that there aren't adequate resources, we felt as the Law Reform Commission, and back when I was with the Commission for Gender Equality, is that the state is obliged in terms of international law and these provisions in the Constitution to take steps to ensure that we've got an adequate social security framework, and specifically to ensure that women have got equal access to health, that they can participate in the economy, that they have access to social security protections, that they have access to social assistance, grants if they need them, and that when the state fails to ensure that women have got this protection, especially during pregnancy, and when that impacts on their ability to earn and their ability to support themselves and their families, and their ability to ensure the development of their child's health and their child's development once the child is born, that actually constitutes discrimination. That is indirect discrimination and violation of that Section 9 equality right. It's discrimination on the basis of gender and sex and pregnancy, and it's a violation of children's rights. So it's not a nice to have. It's not a gosh, when we have enough money. There's an obligation on the state. And my final pitch now, taking off my Law Reform Commission and my Gender Commission hat and back as a social justice advocate, yes, we should continue our lobbying through our state institutions and mechanisms and structures. But my strong view is that if the state fails to enact a measure that would enable women to have access to this right and children to have access to this protection, there is grounds then for strategic litigation. We have strong precedent in case law along similar lines that would be in our favor. I feel if the state is not proactive in enacting these measures, we would be successful to bring this through the courts through strategic litigation and make the case that they are obliged to enact these measures.
Thanks, Janine. Thanks for that comprehensive answer. And I'm glad that we were at least able to keep you on to be able to get that contextualization. There've been a couple of comments coming in from the audience online about cost and implementation. So I think it might be useful here to just speak a little bit to that. I'm just going to ask my colleagues to drop in the DGMT learning brief that was published a few years ago that offers an overview of some of the research that was done by our colleagues, including Debbie Budlander, our colleagues at the Cornerstone Economic Research Unit, and making the case for what kinds of models can we look at in order to be able to finance this. Because I think this is an important conversation and a critical point to your point, Janine, around how do we resource this? And then we'll get into, based off of that, then how would we implement it? And I think the two are connected. The one piece that I think is really critical to nurture just around some of the research that has been done here, some of it has been dated with reference to where we had pegged the child support grant, because ultimately how we thought about it was that the MSG would match what the child support grant is currently. So based on the proposed budget right now, sitting at, I think it's 560 for the child support grant, the models that we had looked at and some of the researchers who've done this work had been looking at the time at the 480 amount, CSG amount. So based off of that, some of the calculations that had been done estimated that if all pregnant women were to get this, it would cost between or approximately 3.3 billion annually. And that would represent about 0.1% of total government expenditure. And the thinking at the time was that this would be funded from the social assistance budget that is administered by SASSA, and ensuring that there is no payment break for women who who are pregnant, who then transition into the child support grant. So it was also trying to rationalize the cost that would be associated to implement this. So back to Wanga's critical point right at the beginning is that we do acknowledge that we are under really different in a different fiscal context in South Africa right now. So we really do need to be thinking strategically around the kinds of interventions that we want to implement, particularly if they actually are innovative, but also have a knock-on economic effect, particularly in the short and medium term. And to Wanga's point earlier is to say that we recognize that this would be a cost, but we're saying that this is a cost that we can actually, that outweighs the 3.3 billion in terms of the costs that are associated with the health, the negative impacts that a woman might go through during those critical stages of pregnancy, but also the longer term cost savings and economic benefits that, based on the research that has been done, we would actually be able to claw back. So Paula, I'm going to ask you maybe just to come in here to then speak to, based off of that, and some of the models that have been done, how might we implement something like this?
Okay, so just to say that, us at the Children's Institute are very excited by the MSG idea because we work both on maternal health and child health. And for that 3 billion rand per year cost, you have huge impact for children and women's health and for the country's economy as a whole, because you save a lot of money in the high costs of neonatal care and maternal care when you get complications and bad health outcomes because you have low birth weight babies, premature babies, moms with anemia, so you prevent all of that. And there have been studies done, a recent one in 2024, which showed a cost saving of 13 billion rand, mainly due to preventing low birth weight babies. So there have been cost analyses done, and it really will be really good bang for your buck expenditure, in South Africa on so many fronts. And it's also so easy to implement. That's also why we like it, because using the CSG model, it would be about ensuring that the mom, the pregnant mom, when she's in her probably the second trimester, would register with SASSA for the MSG. All she'd have to do would be to provide her ID and the same type of proof she would provide for the CSG, which is mainly around employment and income status. So she'd prove she meets the CSG means test, which is very similar to the upper bound means test, upper bound poverty line means test. And she would do that before she gives birth. So it would be during pregnancy. She'd get loaded onto the system. She'd also be made very aware by the health system and SASSA that it's really important she gets her ID in order. What we see with a lot of particularly young women under 20, they don't have their IDs yet. And if they give birth without their IDs, they can't get a birth certificate for their child and they can't get a CSG. So just like we saw with the child support grant, how from its inception, it drove early birth registration because it incentivized birth registration. It made moms realize the value of birth registration. So having an MSG would incentivize women, particularly young women, to go and apply for their IDs, get their IDs in order, get their paperwork in order. So by the time the baby is born, they're on the system, they're already getting the MSG. When the baby's born, they know about the need to get the birth certificate, and it's then converted to the CSG. So that's the idea. 6 months of MSG, potentially another 3 months of MSG because of that potential delay to convert to the CSG. And as soon as the baby gets the birth certificate, then one could even see Home Affairs telling SASSA, okay, birth's registered, and then SASSA can automatically convert it to the CSG without that mom having to stand in a queue with her newborn baby, which is also one of the reasons for the low uptake of infants. It's not always the first thing on a mom's mind with a newborn baby to go stand in a long SASSA queue. And also what's happening at SASSA at the moment is that the queues are much longer than they used to be, and you're waiting a long time just to get an appointment, particularly, at the busy offices, which is delaying infant uptake. So the other reason we're so excited is that because, we have been seeing a decline in infant uptake over the past 5 years. We're now back to 2014 levels in terms of the number of infants on the CSG. So something's happening at Home Affairs or SASSA, that's preventing moms with newborns getting onto that CSG. So our progress is not getting better. We are going backwards. So investing in the MSG would also promote an investment in ensuring that infants are on the CSG early. So it has so many benefits.
Thanks, Paula. And I think that's useful context. And I think the team is going to drop in some of the references to the research that has been done on this, because I think it is useful just to see how that costing has been done in line with what you've been sharing with us now, Paula. I'm seeing some questions in the chat box around what is currently happening in our public health services and what do pregnant women have access to, and where are some of the areas that they may potentially be at risk. And Wanga, I want to bring you in here because I think I saw 2 questions specifically referencing nutrition and also what services are available to women. So the first one, and I'm going to try and integrate them because I think they're linked, is from Fatima Ibrahim from Mikulu Trust, and she's speaking about how there is support in the public health system for pregnant women in terms of provision towards pregnant women's nutrition in the form of pregnancy vitamins and supplements. So I think she's framing that as, is there any support around that? And I think that's such a relevant question to be asking right now, particularly with some of the USAID cuts and what people have access to in the public health system. But then linked to that is the question asked earlier by Tandile, who's based at the Department of Health, around some of the choices that young women, particularly teenagers who fall pregnant, have to make in terms of hiding their pregnancies from their caregivers or their parents. And she's asking, how do we address this in communities, but also how does it affect children's growth? So I think, how do we then encourage young women who are teenagers who are pregnant to be able to access these services? But then linked to Kathima's question, what are those services that are available to them relating to this broader conversation? Try again, Wanga. Let's see if the sound is better.
Can you hear me, Kentse?
No, there's a little bit of feedback. So I think I think we might have to try reconnect you to the mic and then come back. So let's hold that for now, because I think we still have about 15 minutes and then we'll come back to it. Paula, let me come back to you. Wanga, if you could reconnect, so if you could disconnect your mic and then reconnect it, and then we'll answer those questions. And then whilst you're doing that, Wanga, Paula, let me come back to you, because one of the questions that's asked here is about how do we alleviate poverty in rural areas? And we know particularly, I'm just thinking about some of the work that the Children's Institute has done around access to CSG and particularly the trends that we're seeing in rural areas. Could you speak a little bit to why it is important to have a maternal support grant that is targeting women in rural areas because of some of the impact that we've seen around access to the CSG already, and what an intervention like this might change for pregnant women in those contexts and communities?
Okay, so what we've seen with the CSG is that because it's very simple means test, it's an unverified means test, the uptake in rural areas is very high, compared to some of the other grants. And so using the mechanism of the CSG for the MSG would likely replicate that rural bias. So you look at something like the SRD has an urban bias. Because the access is digital, it's using an online platform. So it's got a lot of youth and digitally people who have a digital access, whereas the CSG does better in a rural setting. So one wants to replicate that same system, and that could promote poverty alleviation in rural areas. From the Children's Institute side, we also want to see that child support grant amount increased. So and I shouldn't even use the word increased, because the word is actually restored. Because what's happened to the child support grant is that it's been eroded by inflation, and it's now lower than the food poverty line, 33% lower than the food poverty line, which means that 560 is not enough to even feed one child their basic needs. So if we were to increase that child support grant, children and women in rural areas in particular will feel the benefit. So if we were president for a day, that is what we would do. We would, increase the child support grant tomorrow to the food poverty line. And then, when the MSG is introduced, it would also be at that line. It wouldn't be at an amount that's lower than the food poverty line.
Thanks, Paula. Wanga, let's try one more time.
Hey, can you hear me now?
Yes, we can. So maybe to recap the question for the audience is, what services are currently available to women? Just think about Katima's question, but also the other question that was raised about a very particular at-risk group, which is young women who are teenagers and who fall pregnant, and how they maneuver in this context, relating to then why an intervention like this might very well target them and address some of the challenges that they have.
Absolutely. So services that are available, or at least that pregnant women can access, whether they access them is a different story, but that they can access. So part of the ANC visits would include nutritional, not nutritional, vitamins and supplements such as folic acid, iron for women. They don't get omega-3 fatty acids supplementation, which we now know is so important. But even for the iron and the folic acid that they're supposed to get, that access is very patchy. So clinics, health facilities experience a lot of stockouts. There's a young woman that in January was telling me that she went to the clinic and she asked for the supplements, and because she had heard that they're important for fetal development, and she's 18, and they said there's nothing, there's this one thing only that they'll give her, and it was Panado, and she wasn't sick. She wasn't feeling sick. She was given paracetamol. So it's theoretically there, or it should be available, but there may be issues with accessing those. What is not there is, so pregnant women who are measured as underweight in pregnancy are supposed to get nutritional support in the form of a food parcel, or this porridge supplement that is fortified with vitamins and minerals that they can access. That is even more rare for women to access than even the other supplements. And there seems to be an ad hoc way that is used by different health facilities to decide which woman should get those, which pregnant mother should get those. I've told, one of the stories that I've told over and over again in sharing my research findings is of the pregnant woman who was near delivery, and she was so small, extremely underweight. I didn't know that she was giving birth in 3 days. I thought she was maybe around 4 months, 20 weeks of gestation. And that health facility that she was in had not. So when I asked, what did they say? I mean, has no one told you that she needs support? No, she sees the doctor, she sees the nurses. No one has mentioned anything about her needing. And she was skeletal. You could see it. You didn't even have to sort of get her BMI to see it. That's the same woman who talked about worrying about how her child would fare after birth, given that in the pregnancy, he or she had only experienced hunger, that she had only fed that baby hunger. That's how she put it. And then on to the second question on supporting young mothers. I mean, the stigma, the isolation, which happens in communities and in health facilities themselves, that prevents young women from accessing care in pregnancy. And part of what the MSG would do, which would need to be supported by other interventions that would deal with the stigma, because the stigma prevents them from presenting at the health facility on time. And then once they are there, it prevents them from going back again and again because of the shaming and the treatment that they get. And so the MSG, alongside other interventions to deal with that, would ensure that, first of all, we have a way of capturing these young women in pregnancy, and that you have a way of then retaining them. So part of what this the person who made the comment is talking about is very true. That they end up not getting any services, and that affects their own pregnancy outcomes. It affects the baby. Once the baby is born, it affects the pregnancy itself. And so it would help to deal with that, but it wouldn't just be the maternal support grant. There would have to be other interventions. Thanks.
Wanga, whilst I still have you, it might be worth just touching on, there's a comment here that comes from our colleague, Dr. Simone Honigman, who's at the Perinatal Mental Health Care Center, who's obviously also worked a lot in the space on maternal mental health. And a lot of the points that she's raising in her comments, particularly the last piece around how we need to ensure that what we communicate doesn't lead to increased blame on the mother. But particularly, I want to focus on the point that she raises around maternal mental health and the need to have support. And I want to link this to a piece of work that you often share, that was done by Grow Great and other partners during the pandemic, the Co-Care Impact report that looked at what happens when you do provide a voucher to a pregnant woman and how she utilizes that. And we found some really interesting results, particularly relating to mental health, and PMHP was also involved in that. Can you share a little bit about that? Because I think it is important around, from the work that we've done, we've actually seen evidence around how that does improve maternal mental health outcomes.
Yes, it does. It improves it hugely. And it's, so the co-care voucher was interestingly closer to the current food poverty line amount actually now. I think it was 750. The current food poverty line is 791. So back in 2020, it was much more closely linked. It came the closest to being linked to an objective measure of what a pregnant woman needs when they are sick. But it wasn't a huge amount of money. So for the impact that it had, it's a real case study. It's instructive on how, to us, to the rest of the world, and South Africa in particular, on how these inputs, which are not enormous at an individual level, can have enormous impacts. And part of it was just about relieving the stress of the mother that the pregnant woman has about what she's going to do. Again, not just for herself, not just for her own pregnancy, but for the household. So that money in hand, the immediate relief that it brings, even if there continues to be other struggles that the pregnant woman will have, we cannot underestimate it. And now that we know what impact maternal mental stress has in pregnancy and on outcomes after birth, it's a much smaller investment that's needed than the cost of not doing that. Yes, I've forgotten the other point I was going to make around that.
No, thanks. Wang, I think even just what you shared now is actually quite useful. And I was just struck by a comment that came through from Debuga, who's the director at Sekula Sonke Early Childhood Development, where he or she, my apologies, they speak about how we as a country need to build an active and strong integrated safety net for pregnant women right at the grassroots level. And I think that really also speaks to the heart of the conversation that we're having here this afternoon. So I know that we're about to hit the 1:30, and we plan to sort of wrap up just then. So I do appreciate everybody who's hung on till this moment, even though we started a little bit later. But I did want to give an opportunity, particularly around, we're having this conversation, and we were chatting yesterday around the what next, because I can imagine that everybody who's joined on this call and this webinar is interested on how do we move the needle on this, or how do we participate in the conversation and the different pieces of work that the panelists are involved in individually in their organizations, but also much more broadly. And this is where I'd like the tech team to just maybe share the link to, it was a press release around the MSG Coalition that was shared earlier this year around a group of organizations, including Grow Great, Ilifa Labantwana, the Equality Collective, and many others who alongside us are making the same call that we're making, to say that we need to realize the MSG so that we can tackle some of these intractable social challenges that our panelists have spoken to, that are cross-cutting and integrated, but impact women and particularly pregnant women in very unique and particular ways that require a targeted intervention. So in closing, I do want to give our panelists an opportunity just to share around, in the work that they're driving, apart from, joining the coalition, or perhaps even signing the Grow Great's petition, which is still up, that was put up, I think, in 2023-24, around galvanizing public demand for a maternal support grant. So we'll share that link as well in the chat box. What else can we do? Particularly if you're sitting in a room as, a policymaker, if you're working in government, if you're working, trying to push the needle on this, what are the things that we can pull together in order to move this forward? And I'll start with you, Janine, just thinking about some of the work that you've been doing in the space, and then move to Paula, and then we'll wrap up with Wanga.
Thanks so much for that, and thanks to the colleagues for the really amazing input that they've been making. My suggestions on things that we can do, I think a starting point is we are so privileged that there clearly is political will within the Department of Social Development, that they recognize the significance and the importance. So that's a huge resource. And I think we need to stand alongside and support and buttress the work the Department of Social Development is doing, and equip them with the information that they need to be able to convince their colleagues in Treasury and in Cabinet that this needs to be funded. So my kind of practical suggestions would be to engage with that ministry around understanding what was put before Cabinet and what the rationale was for its being returned. To hear from DSD what their strategy is. They're obviously retreating, regrouping, and intend to return, ensuring that they have this research. I would particularly like to ensure that the Law Reform Commission's recommendations are there amongst that slate of resources, because that's additional support stateside for the need to intervene. So step one would be engage with DSD and lend support and leverage resources, and be a call outside of the state to support the work that they're doing. As our bridge between civil society and the state, as I mentioned, the Commission for Gender Equality, I do think the coalition group should engage with the CGE and request the CGE then to take up with the ministry and with the presidency the concern at Cabinet's rejection of this, if that's what it amounted to, and call upon the CGE to use its constitutional mandate to lobby and advise the state. So I think those are two key interventions. And then we can focus on ourselves within civil society, within academia, researchers, activists, and community stakeholders. How can we lend support in mobilizing the call for this response, but also in leveraging, as I said, the research to equip those actors who have power to put this before decision makers and to ensure that they make the right decision.
Thanks, Janine. Paula?
I think one of the important ways forward is to engage with the Minister of Health. So I believe he is more susceptible to support the idea, mainly because it has a lot of health benefits and cost savings for the Department of Health. And, so I think he is an ally, which the coalition and the Department of Social Development should get together with, so that when the proposal is made again or incorporated into another policy, for instance, that it is presented with support from other ministries, active support, proactive support by the other ministers in Cabinet.
Thanks, Paula. Wanga?
Yes, I was actually going to make the point around how we need an intersectoral approach at the government level.
I'm so sorry. The sound is... I'm so sorry. I know that today has not been the day, but maybe we'll hold it there just because the sound isn't great. But thank you so much, because I know that you were going to say something powerful to sort of bring it to a close. But I think our colleagues are... Oh, there we go.
Yeah, I basically have to switch off my speakers and switch them on again. So I was going to say that I was going to just say something very similar to what Paula has said, which is that we need intersectoral support. I think it's brilliant that DSD is championing this, but for something of this magnitude, as a reform, as a policy reform, you need more than just one sector. And given the health benefits of addressing this, the structural determinants of maternal and child health, the message that the Ministry of Health, not just the minister as as the champion, which he would be a suitable co-champion, but it's that the entire Ministry of Health needs to understand financial support outside of the health system as being a key determinant of what happens within the health system when it comes to supporting mother and child's health outcomes. So that would be the one thing. And then secondly, it's to ensure that we have one voice, a unified voice across civil society, academic partners, and even the private sector, right? It's having the same message. I think part of what needs to be ironed out now is streamlining, so when we bring you big arguments against, and where it can easily be thought of as the two are not the opposite of each other, that we're not on the same page and we're not calling for the same thing. I thought Paula dealt with that very well in talking about how UBIG is extremely important, but the maternal support grant would still be important. So it's fine tweaking the messaging so that it's a single message across all the coalition partners. And then in our own little corner of influence and work, we push the message that the economy of this country, the future of this country depends on how we treat mothers in pregnancy and their children subsequently. Thanks.
Thanks, Wanga. I knew that you were going to end up on a powerful point, so I'm glad that we were able to get that. To our colleagues online, thank you so much for sticking through with us. I know that we had a couple of technical glitches at the beginning, but I'm really honored that we were able to have this conversation, particularly with this panel who represent, I think, such critical views on where are we currently in South Africa on this issue, what are the opportunities, and how do we take this forward? So thank you for the engagement. For those questions that we weren't able to get to, we'd love to be able to respond to those. So we'll engage post the webinar. But for those who are interested in participating and joining the coalition or finding out more, please feel free to reach out and engage with us because we'd love to bring more people into the conversation. But for today, have a wonderful afternoon. Thank you so much for joining us. And I hope that we'll see you in different quarters as we take this work forward. Thank you.
Thank you. Thank you so much. Bye.
Thanks, colleagues.
Bye.
Thanks, Kentse.
Thanks, Kentse.
Bye.
Thanks. Bye.